Good morning, and good afternoon or good evening for those who are joining from all around the world online. Welcome to the Harvard Global Health Institute's third annual symposium. I'm Louise Ivers. I'm a professor here at Harvard Medical School in Global Health and Social Medicine, and I'm the director of the Harvard Global Health Institute. So my team and I are your hosts for today. We want to thank all of you, our guests who are here with us in Cambridge, Massachusetts, and wholeheartedly welcome you. Thank you to all of our speakers. Thank you to all of our participants for spending the day with us and bringing your expertise to the discussions. We are also streaming this event, and we have about 2,000 participants from all around the globe listening in. Thank you so much, and watching. Thank you so much to you all. Harvard Global Health Institute is a university-wide endeavor that serves as a kind of connecting tissue between the multitude of global health activities across the university. Recognizing the manifold and multi-sectoral challenges facing our global society and local communities, we firmly believe that working together is indispensable for progressing towards achieving health equity and health for all. In a time that's marked by somewhat unprecedented change and a lot of uncertainty, the need for empathy and collaboration has never been greater. As we embark on today's conversations under our theme of delivering on the promise of health equity, we find ourselves at a pivotal juncture where the urgency to act has never been more pressing. We already had a lot to do. Now in the US, we're seeing a retreat from global solidarity and a deconstruction of systems of global engagement and collaboration. And I, for one, am very concerned about that. But it is especially in that context that we at HGHI are proud to be convening a multi-sectoral, multinational discussion today of free and open dialogue to exchange ideas. I encourage us all today to move forward with a renewed vigor to action. And as we discuss and engage today, to ask ourselves, what must we do? And what are the most important things that we must do in this moment? So welcome to the conversation. We look forward to engaging with you throughout the day. And this event is being recorded, and it'll be made available on the HGHI website in the days to come. So now it's my distinct pleasure to introduce Dean George Daley, who serves as the Dean of Harvard Medical School and is the Caroline Shields Walker Professor of Medicine. Dean Daley is a physician scientist and a renowned authority on cancer biology and stem cell science. Dean Daley is trained in internal medicine, hematology, oncology, and a longtime member of the HMS faculty whose work spans the fields of basic science and clinical medicine. He's a professor of biological chemistry and molecular pharmacology. He's an incredibly strong supporter of global health endeavors, and I'm delighted to welcome him to open the event. Thank you, Dean Daley.
Thank you so much for the QR code and yeah, these gatherings that Louise and HGHI organize are always extremely important. I cannot imagine a more important time for bringing you all together. So thank you, Louise, for that. It's actually, it's events like these that I think provide a solve for us all in these difficult times. There are tremendous challenges globally. We're feeling them all. And we benefit from coming together and sharing our experiences and identifying core issues that we can do, that we can affect. So I want to say that I am very proud that this symposium really reflects some of the strongest values that I believe Harvard holds. integrity, openness, humility, despite what some would say about us, service, despite what some would say about us, compassion, and most importantly, equity, health equity, which sadly has somehow become a beacon term that draws attention to grants that should be canceled. It's a Orwellian kind of conundrum here. The fact is that Harvard Medical School, and in particular the mission of the Department of Global Health and Social Medicine, which was led for so many years by Paul Farmer, who was a major champion of global health equity, and for which we have really adopted global health equity as a core part of the whole Harvard Medical School mission. It's not just an option that we choose, it's an imperative. And I know that all of you share that objective, and it's the reason that you're also heavily engaged with some of the most important work that there is on the planet. So throughout today's symposium, you're going to hear from experts who are really delivering on the aspirations and the promise of health equity from a variety of perspectives, using a variety of tools. And I hope that you're going to find some hope and some inspiration in their stories. So one such speaker is the author and philanthropist John Green, whom the Harvard Medical School professor of Global Health and Social Medicine, Carol Mitnick, is Carol here? Not here yet, but apparently she's set up to interview about the online social movements and how they can advance the cause of global health equity. So Mr. Green has a new book out titled Everything is Tuberculosis, the history and persistence of our deadliest infection. In the book, he notes that in 2023, more people worldwide died of tuberculosis than died of malaria, typhoid, and war combined. That's saying something. He correctly calls this a tragedy, argues that from a policy standpoint, it's been a choice to let people die of this highly treatable disease. So I think there are very few excuses why we shouldn't be fighting it. And unfortunately, choices are being made not to. So we're seeing choices taken at our federal level to back out of our commitment to global health leadership. The United States withdrawal from the World Health Organization impedes our ability to detect, respond to emerging disease threats. It means we will lose access to important data shared by member countries. Global infectious disease is a national security issue. Furthermore, the administration's choice to gut the U.S. Agency for International Development means that more women across the world will die in childbirth, more children will die of pneumonia or malaria, more malicious forms of infectious disease will develop and spread. Global infectious disease is a national security issue. I was recently at an event, the Breakthrough Prizes on Saturday night, where breakthrough science is celebrated in the setting of Los Angeles with lots of the Hollywood stars. Bill Gates was there, and I had a chance to talk with Bill. And he shared his consternation about the dissembling of a lot of the USAID infrastructure, which the Gates Foundation partners with in many settings for the delivery of HIV and TB drugs. And even a foundation as powerful as the Gates can't make up for the loss of that infrastructure, which he was bemoaning. So I think today we have to choose to think creatively and collaboratively about how we can fill this void. We can choose to remain undeterred in the difficult tasks in front of us. We can choose to continue to advocate unabashedly for the importance of global health equity and for equitable partnerships that leave countries feeling more stable, more supported, and ultimately more free. It's an issue of national security. And indeed, we can choose to work toward multidisciplinary approaches to global health service and delivery, care delivery. We can continue to address the social determinants of health, which lead to health inequities, to strengthen our primary care systems here in the US and around the globe. And indeed, we can control the things that we can control, and that is all of the passionate work that you all do to advance global health equity. And these are the choices that we can control and we can make. So I just want to extend my tremendous gratitude to all of the efforts of the Harvard Global Health Institute, all of you, all of the researchers that come together, the students, the faculty, the staff, for all of the important and good work that you do. It's important. It's a matter of national security. So as Buckminster Fuller once said, my wife used to work for Bucky, and she repeats this frequently. We are all one people on this very tiny spaceship Earth. There is no world in which we are not accountable to one another, in which our cooperation is not absolutely paramount. And so through the Global Health Institute, we don't just study global health challenges, we actively model the global cooperation that is needed to solve them. So thank you, and please enjoy and learn from all of today's presenters. Thank you very much. Louise.